The most common symptoms associated with a urinary tract infection include you have to go pee all the time, but when you sit down, nothing comes out, and you might experience burning or pain. Now, the first two symptoms sound a lot like pregnancy. Pregnant women have to go to the bathroom all the time, and then they feel like they wasted their time because not much came out. Your bladder is just squished. So a lot of pregnant women don't actually know they have a urinary tract infection or UTI unless they have burning when they urinate, and it prompts them to get checked out. If you ever experience this, call your OB provider, and all it involves is obtaining a urine sample and checking it for bacteria and other signs of infection. If it comes back positive, your doctor will probably treat you with an antibiotic that will get rid of the infection. Make sure you take the entire course to get rid of it. One of the important things to keep in mind is that you should always get checked out sooner rather than later for this, because actually the most common symptom a pregnant woman has when she has a urinary tract infection is contractions. So every preterm woman that comes into the hospital contracting gets to obtain a urine sample. We always send that off, and actually as a nurse I'm kind of glad if it comes back positive, because that explains the reason for your contractions, and we can treat it and stop your contractions that day and send you home to have a happy, healthy, full-term pregnancy. But if it goes on too long or it's untreated, then it can lead to the type of contractions that cause your cervix to dilate. For example, one time I had a patient who came in around 30 weeks of pregnancy, and she'd been contracting for 4 days, and she had a raging urinary tract infection, and she ended up delivering her baby a couple of days later. But had she come in sooner rather than later, before she had so many contractions that she got to 4 centimeters, she probably would have been just fine. So again, always important to get checked out sooner rather than later. With the proper medical attention and treatment, it's usually not a problem. If you have more questions for me in the future, please feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.